I have an enormous advantage in that we were able to have 4 children who not only taught me about raising children, but taught me about the role and responsibility of parenthood. I am able to lead several doctors and many, many nurses in how we partner with the parents as the parents of a baby in the care of their child.
We try and make them laugh, and usually manage to do that. Families too, because they're very stressed. They need to kind of relax a bit and get back to a normal life. And life with diabetes can be very difficult and stressful on families.
I really enjoy working with the families and the parents. Sometimes when they're frustrated, and they're in the room for, day after day, and it's a long day, and nurses and doctors can only come in so often. So, as child life specialists, we try to check in with the families and ask them, even if it's a cup of coffee, do you need something, or just to be an ear to listen. It really helps with the family-centered care.
I spend a lot of time talking directly to the child, if they're old enough to interact with me. The little infants, I play with them, cuddle them, make them laugh. I mean, that's really fun. And I think the parents, it puts them at ease, knowing that the person they're seeing truly cares about their baby, their child, and them.
They will be part of the answer and the solution and the treatment, not just we're going to tell them what will happen, but they will be active part of the decision making.
I try to educate the parents so that we can be teammates, because they see the kid 24/7, 365. I see them every 3 weeks, 5 weeks, 6 months, a year. And so it's understanding what to look for so that they know about, for their kids, what are the changes that can occur that may be cardiac related.
Diabetes management is not one person, it's not me, it's not the child, it's not the parents, it's not the dietitian, it's not the educator, it's everybody. And lines of communication have got to be open.
I think having your own children and being a parent makes you much more empathetic with parents when they call at 2 a.m. And say, my child is crying or is awake and no one's sleeping. Having lived through many sleepless nights with my own kids when they're sick and when they're up, and even the common cold when someone's been crying for 4 hours is stressful to deal with. And I think it helps me to relate to them better and to know what they're going through.
The first thing I try to do is connect with the mother, to let them know who I am, why I'm here, and that I'm going to do everything I can possible to take, really good care of their child.